I'm very pleased to spend time with you here today. For those of you that don't know me, I'm Flip Steinauer. I'm the Director of Human Resources for IU13, and we are really happy that all of you are here today to learn more about our newest initiative, which is going to be to have an on-site medical center here at our borough office, as well as working on getting our on-site medical center soon to be open at our Lebanon location as well. So with the other scenarios that we've done, I've been doing these programs with Shannon, and today we're fortunate enough that we actually have our representative in from QuadMed. So Lori Gumbel is in, and she is the person who is our main contact and will be working with us to get the centers up and running here at IU13. So Lori's actually going to do your whole seminar today, and we're going to go about 25 minutes, and then we're going to turn it over to some Q&A at the end. We've got about a half an hour. We're going to try to stay pretty strict with our timeline of a half an hour, but we're going to turn it over to you at the end for Q&A for about 5 minutes or so. But I think Lori will answer most of your questions along the way. So Lori, thank you for coming the whole way from Indianapolis, is where she came from. So thank you.
Thank you. Thank you. Thanks for coming and sharing your lunch with us today. I think that you'll find that this seminar will be well worth your time. If I start to talk a little bit lower, those of you in the back, if you just give me a heads up and I'll speak up. But my husband tells me I'm loud enough without a microphone. So let me know. Today we certainly want to talk to you about what your new wellness center is. Talk about who's eligible, what services are available. It's really important for us to spend a minute talking about confidentiality. From time to time I hear of concerns from employees about an on-site center, so we want to spend some time talking about that. And as Flip mentioned, take any additional questions and how to then get engaged to utilize the services. So let's start talking about what the Wellness Center is. The Wellness Center really is when you think of your primary care provider, that's what our center is. So when you think of the services that your normal family doctor would provide, you can expect generally those same services within the Wellness Center. And as Flip mentioned, we're going to have a location here and one in Lebanon. So great convenient access for you. And you can expect very high quality, patient-focused care here in the center. I want to spend a minute just telling you a bit about who QuadMed is. Our parent company is QuadGraphics. We have 26,000 employees throughout the world. QuadMed was started about 25 years ago when the owner of QuadGraphics thought there is a better way to provide health care for his employees. So he started an on-site clinic when no one else was providing on-site services for their employees. So out of that grew our company, and we have about 1,500 employees now throughout the country. Anyone who is currently on the IU13 plan, that includes you as employees, dependent spouses and children, as long as they're on your plan, are eligible to utilize the services that we talk about today. Okay? And as I mentioned, from time to time, I encounter employees who can be a little bit concerned about the confidentiality of your personal private information. I want you to know that we're bound by the same federal guidelines, HIPAA requirements as any other provider. We're not allowed, we're bound by law to protect your information. All of our medical records are electronic medical records, and they reside on our system, not on the IU system, completely separate systems. So no ability for anyone to gain access to your information. We can share your information with a specialist or something of that nature, but it's only at your request. So know that we take the confidentiality of your information very seriously. Now, I want you to know there will be things that we'll share with the IU. We will be talking about whether or not the times are working for you, whether or not we need to add hours, or rearrange the hours, whether or not we need to add additional services based on aggregate information about your population, but never any identifiable, never any individual information. Does that make sense to everyone? Great. If any of you have concerns about that, please talk to me about it after or give our office a call. We're happy to talk to you about that further. Just to continue, we take your confidentiality seriously. So if there's ever a situation where you feel like you need to talk to somebody about the care that you received in the center, if you feel like you just weren't treated appropriately, or maybe you got so much information when you got home you just weren't sure exactly what you were told, we want to hear from you. So we have a nurse who is available to you during normal business hours, who has access to your medical records, can review your particular case, answer any of your questions, and if you feel that you received care or treatment that really wasn't appropriate, that nurse can work with the staff to ensure that all of your questions are answered, and if there's an issue that needs to be addressed, we'll address that as well. Okay? So you don't have to feel like your only recourse is to come back and talk to Flip or someone here. You have a confidential means to communicate with us. Okay? So let's talk about services that are available. As I mentioned, when you think of a primary care provider, those are the services that are available here, and we're talking about primary and secondary disease prevention. So if you're someone who has high blood pressure, high cholesterol, or diabetes, we're going to be able to help you with that. We're able to help you with acute, sudden onset conditions, something that might need an antibiotic, those kinds of things. Certain minor procedures, it will be up to the doctor to say yes, he feels comfortable with that procedure or not. But certainly we want you to come in and talk to the doctor about what your needs are, and many of those can be taken care of inside the center. Certain vaccinations will be available, lab work, routine screenings, and generic prepackaged medications. Many of those will be in a 90-day supply. And again, when we talk about medications that will be available to you, we're talking about sudden onset conditions like skin condition or something that might need an antibiotic, something of that nature, but also ongoing conditions, again, like high blood pressure, diabetes, and high cholesterol. So a wide range of medications that are available. Now, they're generic medications, and we're not a pharmacy, so we don't have every medication that is on the market, but we have 60 to 70 of the most commonly prescribed medications that are on the market, and availability, additional medications that are available to you. So I often ask the question, can I get a list of the medications? We generally don't provide the list because we would, just our nature, to take a look at the list and say that medication isn't on the list, so this isn't going to help me. When maybe a similar medication is available, or maybe we have access to it, we just don't have it in the center yet. So we want you to make an appointment, come in and talk about your unique situation with the provider and see how we can best help you. Does that make sense? Okay. The center is to help you with ongoing conditions or acute conditions, but we also want you to think of the center in terms of your wellness treatment as well. So we're able to help you with your annual physicals, annual male and female exams, sports physicals for the kids, those kinds of things also available, not just for treatment of sicknesses. It's a wellness center. We'll have a wellness coach on site, so if you're someone who wants to start a fitness routine or weight management program, the coach is going to be able to help you with that. If you're someone who is maybe newly diagnosed with hypertension or diabetes or high cholesterol and want to try to treat that through wellness measures, something that the health coach might be able to help you with your diet, the health coach is a perfect way to start that type of program. And you can meet with that wellness coach regularly to try to meet your goals. Okay? You'll also have access to a wellness portal. And a couple of really great features of the portal that I'll mention. You can log your food and your calories. It will help you develop menu plans. It will help you track water and fitness goals and those kinds of things. A wide array of services available to you through the wellness portal. So really encourage you to go out, load the app, and start using that wellness portal as soon as you can. Physical therapy services will also be available to you inside the center. So if you're someone who is, suffering with a bad back, or me, I have a bad foot, or those kinds of things, I really encourage you to come in, see the doctors, find out how the physical therapy might be able to help you get on the road to wellness. When you're in the center, we're so used to anymore coming in and spending, the national average of time we spend with our doctors is 7 minutes. Sometimes it feels like they don't even take their hand off the doorknob, right? Not every provider, but many of them, right? So in our centers, your first visit will be 40 minutes, and any physical exam will be 40 minutes. So plenty of time for you to get to know the doctor and the doctor to get to know you and your particular situation. Subsequent appointments are 20 minutes. So again, lots of time to talk about what's on your mind and to be able to talk about how to address some of your wellness goals. And if you're someone who feels that from time to time you want to spend a little bit more time than just 20 minutes, you have something going on that you just think 20 minutes won't be enough, you're encouraged to schedule longer. Okay? So don't feel that you're even locked into that 20-minute limit, okay? It's a general guideline. There are certain services that won't be offered inside the center. So generally, our provider is going to be a family physician. So specialty services would be something that might be referred outside of the center. Medications that aren't available in the center and we don't have access to, you'll get a written script and you can fill that out in the retail market just like you do now, or submit it through mail order just like you do now. We don't generally provide chronic pain management or long-term controlled substances. ADHD management's not provided in the center, and we don't have imaging services, so mammograms and those kinds of things wouldn't be available. Okay? As we mentioned, we'll have 2 locations. Those are the addresses. I think you know where the one here is, right? I can't wait for you to see it. For those times when you have a situation that comes up when the center isn't open, you wake up sick. I'll tell you my situation. I have an 8-year-old daughter who a couple weeks ago woke up on a Saturday morning sick. Our center isn't open on Saturdays. So you'll have access to 24/7 telemedicine services. So you'll be able to load an app on your phone, and anyone who has, an iPhone, you're FaceTime with a provider 24/7, and that will be no cost to you. So in my situation, my daughter had a really red sore throat, so I had the pediatrician on my phone. We talked about her symptoms. She asked me to see if she had swelling. I held the phone up and a light to her throat, so she looked in her throat and she called in a script. Nothing better on a Saturday morning than having your kid in jammies and having her taken care of. So you'll have that access to 24/7 care, which will be a really fabulous benefit for you. We always want to try to have same-day appointments. It's our goal. I'll tell you that it's not always. Some days are busier than others. Mondays are always busy, of course, right? Just like in the community, Mondays can be busy. But we want to try to run at about 85% utilization. So 85% of the doctor's time is scheduled. So we have plenty of opportunity for you to get in same day or next day. So that's really important to us. We your time is very important to us. Your time is valuable to you. It's very important to us. So we are by appointment only. When you call your doctor now and they work you in, they're working you in by pushing someone else, squeezing their appointment down, right? Your 20 minutes is your 20 minutes. So we are by appointment only. So no walk-ins would be allowed. That's not to say that if you stop in or give us a call same day and say, do you have any time available? Our hope is that there would be time for you that day and that we would be able to get you in. And certainly if the next appointment is available and you walk in, we're going to put you in. But generally we're by appointment only. Does that make sense? Okay. And I wanted to just point out to you that calls will come into our patient services center. So the calls aren't going directly into the wellness center here. They'll come into our patient services department in our Indianapolis office. But if any time you say, I really need to speak to the nurse or the doctor, we'll get you through to them. Okay? So let's talk about all of this. Sounds like a pretty nice offering, right? No cost to you. No out of pocket for any of your office services, lab work, medications, any of the surgery or your physical therapy, or the 24/7. Is there a skeptic in the room? Yeah. There won't be any cost to you. Now, if there is a service that you're referred outside, what I generally say is any service within the four walls of the center is free of charge to you. If you're referred outside of the center for anything, then that charge will flow through your benefit plan and normal deductible copay and out-of-pocket would apply. So if you're in the center and referred to a specialist, that's going to flow through your benefit plan. If the doctor in the center asks you to go for an x-ray, that's going to flow through your benefit plan. That make sense? Okay. We're having an open house here at the end of the month on the 30th, and you'll see additional information about that. So I really encourage you to come and walk through. Our hope is that our doctor, we're working on securing the doctor and getting the doctors and the nurses on board. Our hope is that you'll be able to come in to the open house and meet the staff and tour the center. I want to show you around and just help you know what services are available to you, okay? So on the 30th, you'll see more information coming on that. And then the first part of April, the center will be open, and you'll be seeing more information about exactly what date. And then coming soon will be Lebanon. So how do you schedule an appointment? If you're someone who likes to use online tools, you can go online 24/7 and schedule an appointment. So if you're like me, I always think about it after the call center closes. You can go 24/7. You wake up in the middle of the night, you can go online, you can schedule your appointment, get that locked in so you know how to plan your day. What do we do now? We have to wait till 9 o'clock till the doctor's office opens. So you don't know how to plan your day. Or even if they'll be able to get you in. So 24/7, you can go in and schedule your appointment. But if you're someone who doesn't like online tools, you can also call our office. We're there at 6 in the morning, and then we're there till 8 at night. So plenty of availability for you if you need to speak with us. And we also have an app that you can load on your phone to schedule appointments. So great access for you. All information, of course, is secure information, even utilizing the app. And if you still have questions, please ask me. But afterwards, tomorrow, if you think of a question, feel free to give our office a call. We can help you. Or stop in to HR and talk to them, and they could answer your question. And Flip, did you want to talk about the survey?
Yeah, the survey that is listed up here, we're actually getting ready to, sorry, don't want to walk behind you here. The survey is something that we know not everybody here is feeling comfortable about asking questions in a group of 50 people. You might have something that's specific to you. So that's where you have a confidential, you can ask it anonymously, and then we're going to provide answers back. to the surveys that we get off the Survey Monkey, or questions we get off the Survey Monkey. We'll provide that information back to the group, because while you may not be thinking about it, but your neighbor is, and they don't want to ask about it now, when we put it back out to you, you'll say, oh, that's a really good question. I hadn't thought about that. Yeah. So we will be providing you that Survey Monkey data for you to ask questions.
What other questions do you have?
Well, with the one piece I also want to say, and you didn't catch this when you said it, Lori, you said everybody knows where the location is here. 1042 New Holland Avenue, we all know this building is 1020 New Holland Avenue, but this building and every employer in this building has a different number. So QuadMed will have its own number. So that's why they're listed as 1042, but they're physically in the same building that's here. So I just wanted to make sure all of you that looked up there and said, wait a second, that number doesn't look right, that's why it is not the same. A couple of you, I just heard you say, what are the hours? We're not sure the hours yet, because we got to wait till we get a physician hired. So that's going to be dictated by the physician. We know right now that we're going to be open 30 hours a week. And 30 hours a week are going to be split between here and Lebanon. Up front, they're going to be here 100% till the Lebanon office is open. Once we get the Lebanon office open, then we're going to go 22 in Lancaster, 8 in Lebanon. All right? The hours are going to be some before morning or early morning, so there'll be like a 6:30, 7 o'clock opening time, and maybe run till 11 o'clock in the morning. And then there's going to be other days that we're going to have office opens at 3 o'clock in the afternoon and goes till 7 at night, because we know that we need to schedule around your workday. And not everybody's going to be able to get out and do this during the work hours. So we recognize that. So we were very clear and consciously made those decisions about how to schedule the hours. But what the hours actually are, we don't know yet until we have that final determination of the doctor. Other questions?
If we would like to make an appointment, say we're at work and we can work, but you have a sinus infection or something, are we allowed to, and we have a half-hour lunch break, can we take our lunch at 10 a.m. for a doctor's appointment? Or, can we use that half-hour lunch break for our doctor's appointment?
That's a great question. We've had that brought up by a couple other people as well. We're working through how that's going to work right now. I can't give you an answer today for that, but we are aware of that. We're trying to figure out how we can make that work for everybody. But I don't have the answer for you right now. Yes?
Yeah. You can. I mentioned I have a daughter. We have a pediatrician. I take her there once a year. She knows about our center, and the center knows that we take her over there. So I always encourage you to make sure everyone knows. But yes, and then if you stay with your PCP, but you want to utilize some of the services, maybe labs and meds, we're not a pharmacy or a lab, so come in and see the doctor. As long as the doctor agrees with your treatment, you can get those meds and labs in the center at no cost. We just always want you to make sure that everyone knows that you're seeing another provider. And we can send those records over to your primary care if you like as well. Just let us know.
So just to clarify, can I just clarify that for a second? Because that was a question that came up in the other meeting. So if a person goes to the doctor, their primary care physician at home, and the doctor says you need cholesterol medication and we're sending you now, QuadMed doctor meets with you to determine, yep, we agree with the cholesterol medication. Now that's an ongoing treatment over and over and over again. There doesn't need to be a new appointment every time, correct?
The doctor may, depending on your situation, say I need for you to come in and get labs every 3 months. Some of those cholesterol medicines you need to come in and get labs. So he may end up saying, I'll give you a 12-month script for you to get your meds here, and then come back in and see me just to keep track. Our doc is responsible for all the treatment that is provided out of the center. So he just may ask you to come in for a quick checkup every year, something like that.
Go ahead.
So you're someone who is on a routine medicine, you get labs done. In order to get those free labs, it would have to be one of the physicians here, not the outside physician.
That's right. So come in and just see us. It's a great time for you to go ahead and get established with the doctor so you're ready. Sometimes people wait, they don't have anything ongoing, so I'll just wait to go in. And then you get sick, and your first appointment is 40 minutes, and no one wants to have a fever and be sick and sit through a 40-minute appointment getting to know a doctor, right? So go ahead and get your routine physical out of the way. Meet the doctor, allow the doctor to get to know you so you're ready to go when you need something.
That's a really important thing that we're trying to emphasize with some of the other groups is make sure you understand your first appointment will always be a 40-minute appointment. So again, to Lori's point, get that out of the way when you're healthy and feel well rather than the day where you're really feeling crappy and you don't want to spend 40 minutes in the office. So get that out of the way as soon as you can.
Yeah. A good time, too, you can always set up an appointment to meet with the wellness coach.
Yeah. And to your question of how quickly can we expand is going to be based on their experience says that for 864 lives, which is what we cover, it's employee lives, 864 lives, average time to utilize 85% utilization requires about 30 hours of time. So that's their experience with all their book of business across the United States. That's where the number came from. We didn't pick that number. That was a number that was provided to us by QuadMed to say that's where you want to start at. And again, it can expand as soon as we get more people that are using the center.
Now, some use it much more than others. So, we quickly need to add hours. So it's, as Flip mentioned, our experience tells us this is a good starting schedule, but we want to add more.
We will have 4 staff members at this location, and the same people will serve this location as well as Lebanon. The 4 staff members are the following. We'll have a doctor, we'll have a wellness coach, we'll have a physical therapist, and we'll have a medical assistant/nurse. Those are the 4 positions that we'll have serving this. So if you say, and this was a question we got last meeting was, well, what if I want to go, sometimes I'll go in Lancaster and sometimes I may go to Lebanon. I want to have the same doctor or same opportunity to see the same doctor. You're going to see the same staff. They're at both locations. So that's the makeup of the staff in which you're going to be interacting with at the locations. I want to say to all of you, thank you very much for coming. We really appreciate your interest in this, and I'm going to tell you, this is going to be a great thing for us when we get these up and running. You're going to see how much this is going to save you time, money, energy. You're not going to be running all over the place to get your medical care. It's really going to be a great opportunity. Thank you very much for coming today. Lori, thank you for coming in from Indianapolis. We appreciate it.
Thank you.